Welcome friends, welcome to my channel, Pain Policy Practice. Today we are going to talk more about chronic pain. Chronic pain is one of the most misunderstood conditions in medicine. Patients often feel dismissed, physicians often feel frustrated, and everyone feels stuck. If you ever wondered why chronic pain is so difficult to treat, here's a reason. Chronic pain is not just pain that lasts a long time. By definition, it's pain that continues beyond normal tissue healing, usually more than 3 to 6 months. But here's the key points. It's no longer just a symptom. It becomes a condition of the nervous system itself. In acute pain, for example, we treat the cause, a fracture, inflammation, infection. We fix the injury, and then the pain improves. However, in chronic pain, the nervous system becomes more sensitized. The brain amplifies signals. Pain pathways remain active even when scans look normal. So that's why physicians do not often rely on imaging, because they don't match how severe the pain feels. And that mismatch is where the frustration begins for both patients and clinicians. So why is treatment so hard? Because there is no single fix. Opioids do not reverse the nervous system sensitization. Injections may help certain structures, but not the entire pain network. Factors like stress, sleep, mood, past trauma all influence how pain is experienced. Chronic pain is complex because it's biological, psychological, and neurological at the same time. But what actually works? A multimodal approach. Medications when appropriate, physical therapy, behavioral strategies, interventional options for selected patients, and realistic goals. The goal is rarely to have zero pain. The goal is to improve function, safety, and improved quality of life. So let's recap the 5 pillars I mentioned in the last video: living with chronic pain, clinical chronic pain management, CMS and coverage rules, billing, coding, and documentation, business of medicine and physician sustainability. So living with chronic pain, coming to the first pillar, what are some of the practical daily strategies that actually help? If you live with chronic pain, you already know this. It's not just about pain. It's about how pain affects your energy, your sleep, your mood, your work, and your relationships. And one of the hardest parts is that people around you may only see the pain, not the effort it takes just to get through a normal day. Today, I want to talk about daily strategies that actually help. Not miracle cures, not unrealistic promises, but practical tools that can make life more manageable. So first, we need to reset expectations in a healthy way. Chronic pain is rarely cured overnight, and for many people, it isn't cured at all. The goal isn't zero pain. The goal is better function, better control, and fewer bad days. Chronic pain becomes different from acute pain because the nervous system changes. Pain signals can stay active even after tissues heal. The brain becomes more sensitive. But that doesn't mean your pain isn't real. It means the system processing pain has become more amplified. But when pain becomes a nervous system condition, the strategy shifts. It becomes about management, not just fixing. So what's the core strategy number 1? Pacing instead of pushing. So the first daily strategy is pacing. Many people with chronic pain fall into a push and crash cycle. So, like for example, you might think on a good day, oh, I'm going to do everything. And sometimes we overdo things and we go into a severe flare. Or sometimes we go into a forced rest and do the guilt trip. So what does pacing mean? Pacing means breaking tasks into smaller segments, stopping before the pain spikes, not after. For example, instead of cleaning the whole house, clean one room. Instead of walking 30 minutes once, walk 10 minutes 3 times. But this is not about giving up. It's strategic energy management. And what's the core strategy number 2? Protect your sleep. I cannot emphasize enough. Pain disrupts sleep, but poor sleep also increases pain sensitivity. Sleep deprivation lowers pain threshold. Brain becomes more reactive. So what are some of the practical steps? Regular bedtime, dim lights at night, reduce late night screen use, calm wind down routine. You may not eliminate pain at night, but you can at least protect the routine. Core strategy number 3, movement and not avoidance. The third strategy is movement, but gentle, consistent movement when pain becomes chronic. The instinct is to avoid movement. That makes sense, but complete avoidance leads to deconditioning. And what I mean by deconditioning is muscles weaken, joints stiffen, confidence drops. Movement doesn't mean intense exercise. It means consistent, tolerable activity. Like, for example, light stretching, walking, water therapy, physical therapy. So consistency beats intensity. And finally, the emotional strategy. Flares are not personal failures. Okay, now let's talk about something just as important, the emotional side. Pain flares are not personal failures. Remember, friends, you did not cause your nervous system to amplify signals. It's not your fault. And a flare does not mean you've undone all your progress. We will talk about flare pain. We'll talk about reducing activity temporarily, using calming techniques, or avoiding panic. But the worst flares often happen when fear amplifies pain. We'll talk about all of the mental health in another video. But chronic pain management is not about winning every day. It's about building resilience over time. Like we say, small battles, winning these small battles we fight every day. So coming to resilience, fewer severe crashes, faster recovery from flares, more predictable days, improvement in chronic pain often is gradual and uneven. Small improvements matter big time. So friends, if you're living with chronic pain, I want you to hear this clearly. Your experience is real. Your frustration makes sense. And management is possible even if cure is not. In the next video, we'll talk about mental health and chronic pain and why that connection between the brain and pain is one of the most misunderstood parts of this condition. This is Pain, Policy, and Practice, and we'll keep having these conversations clearly and honestly. Thank you for watching my channel. I appreciate it a lot.